Good afternoon, everyone. Thank you all for finding time to attend today's webinar. My name is Laura Rodriguez, and I am the Director of Marketing at SureImpact. Today, our topic is moving from outputs to outcomes to increase financial and mission impact. Our speaker today is Sheri Chaney Jones, founder and president of SureImpact and Measurement Resources Company. For more than 18 years, Sheri has improved the social sector using performance management, evaluation, and organizational behavior best practices. She's the author of Impact and Excellence, Data-Driven Strategies for Aligning Mission, Culture, and Performance in Nonprofit and Government Organizations. Just a quick note, we'll answer questions submitted by you found in the Zoom meeting panel. Feel free to submit as many questions as you would like. Although we may not be able to answer all of them, we can certainly address them in our follow-up. So with that, I'm going to go ahead and turn the time over to Sheri.
Thank you, Laurel. Welcome, everyone. I am so honored and grateful to spend time with you today. Laurel told you a little bit about me, but I want to know a little bit more about who you are. So Laurel, if you can launch this poll, please tell us more about your organization. Which best represents your organization? Are you from government, nonprofit, social service, or nonprofit arts and culture, some other type of nonprofit, a for-profit organization? You're just here and want to learn more about our topic and don't represent an organization. Pick the best one. I'm sure there's others that you represent that aren't on this list, but please go ahead and submit your answer. Okay, great. So most of you are coming from a nonprofit social service that will help me tailor some of the topics and the examples, but I understand we do have a wide variety from arts and culture to government to other sectors in the nonprofit. So you're all in the right place. That's what I want to share with you today. Regardless of any of these entities that you're with, I think hopefully we'll have a great conversation today and you'll learn something that you can start to implement as easy as this afternoon in your organization. Okay, so today's topic, as you know, is moving from outputs to outcomes. And I have been talking about outcomes with people for my whole entire career. And what I have learned is that it's not everyone's favorite topic. Some people love it like me, other people, it's not their favorite. So what I'd love for you to do in the chat, type one word, phrase, or metaphor that comes to mind when you think of outcomes. So at the bottom of your screen, there's a chat function that you should be able to find. And I'd just love to see what kind of words, phrase, or metaphors come up when you think about the word outcomes. Okay, got results. Janet says results. Fred says results. Impact. Compass. Ooh, I like that, Kathleen. Life change. Linda, you're right. Definitely can change your life. Jen says goals met. Effectiveness. Jessica says change. Effectiveness of service, says Jeannie. Retha, impact. Diane, proof of work complete. Carlene, proving what you do is getting results. We've got Leslie with responsibility, accountability, promised land, impact. This is great. Connie says focus. Jessica says quality. Awesome. Absolutely. So, okay, I'm preaching to the choir, I've learned. Sometimes I get people to say hard, difficult, confusing, scared. And if those are your words too, that's great too. Hopefully what I can do for you today is help you see that when we talk about outcomes, it doesn't have to be scary. It doesn't have to be something that feels difficult or hard to do because they are so important to your organization. And it really is moving towards an outcomes culture, moving towards an impact culture is what's going to transform our communities, transform our organizations, and more importantly, create the lasting social change that we're all trying to make today. So let's learn how to do my technology here. Here we go. So I have some guiding principles for our conversation today. And this is around, when we think about impact, when we think about outcomes measurement, there's 4 principles that I think that we have to be adopting and embracing within our organizations and as leaders to move our organization from an outputs focused organization to an impact centric organization. And the very first point is that lasting social change begins with you. Regardless of where you are in your organization, you are a leader. You are leading people, whether it is through the actions that you do, the conversations that you have, even what's passionate and important to you. And so we all have to be advocates for the change. So if we're looking to create an impact-centric organization, it starts with us. It starts with us to say, I'm willing to adopt an impact-centric lens. I'm willing to push my organization forward to be more impact-centered. The second point is that leadership is an action, not a title. It's about the behaviors that one does. And good leadership requires measurement. It is a tool that good leaders use in their toolbox to drive social change forward. The third bullet point that is important that we adopt is that the behavior and the mindsets of social sector leaders will determine our future. So whether it's helping us recover from the impacts of COVID-19 that our communities are experiencing right now, or really improving and driving forward those social determinants of health, or the health inequities we see across communities, or improving vibrant arts and culture communities and making sure children are educated, whatever mission it is that you are driving forward, we as leaders, we have to do certain things, we have to believe certain things, because until we believe certain things, we won't do certain things, and if we don't do the right behaviors, we won't get the right results. And so our actions, our behaviors, our thoughts are going to drive what the future looks like. And the last ingredient is that, or last guiding principle that I believe is that the ingredients for accomplishing social change already exist in our communities. So we don't necessarily need new systems, new organizations, new people. What we need is we need to be thinking about what we measure differently. We need to be thinking about how we measure things differently and how we use data differently to drive the real social change. So imagine a world where you knew what efforts would lead to your desired impact. So all of you have a unique mission. All of you have a purpose and a passion in this world that you're trying to solve for. And what if you knew with certainty that if you did certain behaviors, you would get certain results for the communities and the clients that you serve? Just imagine that. Imagine living in a world where you could write to your funders, you could write a grant or talk to your donors and say, if you invest in these activities, we know with certainty we will produce these outcomes. Secondly, imagine a world that you had all the resources that you needed to achieve your mission. You knew what it would take to solve the social problems in the community. You knew with certainty that if a funder, we've seen these funders in the past just go all in on certain social causes, giving organizations $10 million or more to go, like I know the Dave Thomas Foundation got a giant long-lasting grant because they had impact data and are able, and that funder said, we're going all in for adoption because you've proven your system and your process works. We will give you that type of resources to solve this problem. So what if you were able to have funders call you? You didn't have to write grants. Funders were just calling you and saying, I know your program works. I know you're of value. I know what that social return on investment is. Let's go. Here's the dollars. Let's solve this problem together. And third, imagine if your organization was known as the industry leader, that people knew that you were the way we were going to solve whatever unique social problem that you want to solve, that you truly were the Center for Excellence in Childhood Pediatric Care, or you were the leading edge food bank or the leading edge educational institution. And people just knew we support them, we go to them, we want to be them because we know they're making lasting changes in our community. That's what this webinar is all about. It's about becoming the leaders becoming the organizations that people look up to, that people want to aspire to be, not just leaders in our own organization, but leaders in the world, leaders in the community, and that we're driving social change forward. That's what we're talking about today. And I know what you're thinking right now. You're thinking, Sheri, this is all great, but don't you know there's a global pandemic going on? We're seeing record level unemployment. Actually, I got an email today where someone told me that 40%, don't quote me because I don't know the source, but they said that 40% of people that make less than $40,000 a year in this country have lost their jobs. So I get it. We are living in very, very uncertain times. We likely are going to be in a recession for some time. But the good news story is today is that even in a recession, success is possible. So let's rewind all the way back to 2008. In 2008, I was a government funder. I was looking at grantees from nonprofits, very much like many of you on this call, and we have money. And as we know, there's a lot of money right now coming to the social sector through the CARES Act. There's a lot of foundations are opening up some of their funds for emergency response. So there definitely are sources of funding. It's not a matter of there's not of funding, it's just we have to be more strategic about the funding that we're getting. So back in 2008, I was a government funder. It was my job to look at, the different grant responses and proposals and really decide with our scarce resources we had at the state level, is this particular organization or program worthy of our dollars? And then I also had to be accountable to those who funded us. And during this time, I realized that very few nonprofits were able to show me how they were making a difference and what their impact was. So as a funder, it was very difficult for me to fund them. So I was looking for who can show me impact data. And I tell that story because it actually motivated me to leave state government and start on this journey of helping government and nonprofit organizations all over the United States, Canada, and around the globe become more impact centric. And so to do that, I launched a research study. I created what was called the Measurement Culture Survey and looked at what data organization had, how are they using it to make decisions, and what results were they getting as a result of having this data and having this information. And so this research was done in the midst of the Great Recession. And what we learned was that impact-centric organizations, so organizations who had impact and outcome data, and they were using it to drive decisions, were significantly more likely than organizations who just had output data or organizations who didn't have much data driving their decisions to achieve the outcomes that we all want to achieve. And what I really want, because we're talking today about what if you had all the money you wanted, but so in a recession, organizations that were impact centric, the purple bar on your screen, if you're looking at the screen, 62% of them reported having increased revenues in the midst of a recession versus only 18% of output centric organizations and 12% that had no data. So becoming an impact centric organization is more important now than ever before. So we're going to have to make sure that we're creating, we have those outcomes, we can communicate those outcomes, we're managing to those outcomes, because like back to my original point, our behaviors in our system is what is going to create the lasting social change we would all like to create. So the answer is impact outcomes. It's essential now. We have to move towards it. So why outcomes and impact measurement? Well, besides just having the right, wanting to raise more money, there's some other reasons it's so important as well. Because what we measure and what we communicate gets done. And this has been at a global scale now. This is an example that we all can wrap our heads around. We all understand it. So think about how in the last 2 months, what data have been measured and communicated? How many COVID cases we have? How many deaths have been reported? that is it. Every single day we're updated on these numbers and these dashboards. And as a result, what has happened? Well, we've shut down, we've stayed at home, we've done the things that we need to do to make sure that hospital systems aren't overwhelmed, that people, the disease isn't spreading rampantly. Like, we've done the things we needed to do because the output, the impact data is in front of us every single day. And so this is just an example. I'm not using this as an example to be political. It's just an example of when we all collectively focused on one set of outcome metrics, our behaviors followed. Now let's think of the reverse. Let's say we didn't even talk about how many COVID cases there are, or how many deaths, or who are getting sick. And let's say all we did was talk about the unemployment numbers, and that's all people saw every single day. We would be making different policy decisions. We'd be making different changes. So I share this to show you that it's not, we can't just focus on one metric. It's more complicated than that. And we have to make sure that we have a system of right metrics to take a balanced approach. But what we're measuring and what we're focusing on is going to drive our behavior. So it's very critical that we're focusing on the right outcomes and the right impacts. We also need to ask ourselves, are we making things worse? And outcome data and impact data ensures that we are not creating what some authors have written about around toxic charity or ineffective policy making. And we all have those defining moments in our lives that shape who we are and what we do and why we're passionate about what we're passionate about. And so this is my story, and this is why, for me, outcomes is so essential. So my very first, I call it my big girl job, was working for the Franklin County Domestic and Juvenile Courts. And prior to me being the Deputy Director of Performance Evaluation, they never had anyone in my role that's job was to evaluate all of our programs, to really move them from an output-centric organization to an impact-centric organization. And so the very first program I had the opportunity to look at on paper was a wonderful program. It was working with children that had a lot of adverse childhood experiences in their past, really difficult upbringing, had been in and out of the child welfare system and the juvenile courts. And the whole purpose of this program was to help these young people get onto the right path, keep them out of the justice system, and really get them back into a healthy, vibrant life. And when we looked at this program and we compared the impact of the youth who went through this program versus the impact of youth who did not get assigned to this program, and we held things constant like charge and socioeconomic status and race and other factors. So when we looked at who was better off, what we learned was that actually the program, the kids who were being court ordered to this program, were significantly more likely to recidivate back into juvenile justice than those who were just sent home and didn't have to go through our programming. And so there was nothing wrong with the program. It wasn't that the people making the program wanted to make the kids worse. They all had big hearts. They all thought they were doing the right thing. But the problem was, until that time, we were measuring the wrong things. We were talking about number of people served, number of kids served, demographics of kids that we were serving. We weren't really focusing on, are they better off, and managing to that and making decisions and quality improvement and program improvement. So it's so important that we have outcomes and we're impact focused so that we can be driving our policies, driving our programs to things that actually work, that make people better. And I think that maybe the reason that we haven't been so focused on outcomes and impact is because we may or may not have been measuring the right things. And so let's talk about why we may not have been measuring the right things. So most of our nonprofits are led by, we have boards, we have governing bodies, we have boards, and many times our boards come from the corporate sector, which is wonderful. We need corporate thinking, we need that type of thinking, but we have to understand the differences between a traditional for-profit model and the type of metrics we look at, and a nonprofit model. So the traditional for-profit model, I mean, this is a simple model, but let's just go with it for today, is that our consumer has a problem. So there's somebody who has a problem and a customer pays money for that problem to be solved. And then the business has the solution. So it's a very transactional, I have a problem, you have the solution, I give you money, I'm gonna receive value. If I do receive value, if my problem is solved, if I'm happier, if I'm healthier, if my desires and needs are met, I'm gonna buy from that business again. I'm going to tell all my friends about you, right? And you are going to then have more money because you've provided more value. So money and value and a traditional for-profit model are linked, they're tied. So you can use number of customers or number of transactions as evidence of high performance, because there's an assumption in that model that the more people you serve, that the more volume you do is actually proof that you're making a difference, that people find value in what you provide. Now let's look at our traditional nonprofit or social sector model. It gets a little more complicated because that linear chain of problem, solution, money, value is not the same. It's a little different. So we have a consumer or a community that has a problem, but they have limited resources. That's why the social sector exists, is to solve problems at a much larger scale for people who may not be able to pay for that service. If they were able to pay for that service, the for-profit sector would likely take care of it. So we have a consumer, they have a problem, or a community that has a problem, but they have limited resources. So who has the money? Well, we do, as taxpayers, as government, as corporate foundations, right? As individual donors. So they, out of their, whether it's their philanthropy or that they also are passionate about this problem, or they're passionate about sustainability, whatever their motivation is, they have the resources and they're gonna somehow deliver those resources to the social sector to drive results. So they'll do that through grants, through different competitive selection contracts or other things. And so the social sector organization has to go and write for those grants. They have to communicate how their quality organization and that they're not fraudulent and they're going to solve this problem, right? They're that whole fundraising mechanism. And if you win the grant, great, now you have more money and you have evidence of fiscal high performance because you've created this great system where you can attract the dollars you need to do your mission, essentially. But just because, if you look down that purple chain, just because you've generated these resources, we've not even talked about the person with the problem yet. We've just talked about you did a great job writing a grant or did a great fundraising appeal. So when we look at the blue chain, we then have to have the person who has a problem, deliver services to them, the consumer or the community is better off. Now we have evidence of mission high performance. So we need to have metrics of both. If we just use dollars in as a measure of success, we might be completely missing if we're really solving the problems that our community has. Because in this model, money and impact are not necessarily tied. The number of people we serve and impact are not necessarily tied, because in most cases, except for we are moving, because I think collectively we've understood that this system, this old system, isn't working anymore, because we've been spending money and money at social problems, and in some cases things have gotten worse. And they've gotten worse because we forgot to be managing to the right things. So now we've seen pay per success models and many more outcomes funding. I'm paying for outcomes instead of outputs because of this, because of the realization that just the number of people you serve has no really understanding of if someone is better off. Okay, so the title of this webinar is Moving from Outputs to Outcomes. I hope you either have just ate lunch or are currently eating your lunch. I apologize if these slides are making you hungry, but let's get a level set on when I'm talking about outputs and when I'm talking about outcomes, truly what's the difference and how do we move from being output centric to outcome centric? All right, so get ready for the chat because this is a participation question. So McDonald's sells 33 million hamburgers a day. Five Guys sells 350,000 hamburgers a day. In the chat, I want you to answer this question. Who makes the better hamburger? Go. All right, we got a couple votes for Five Guys. Five Guys. Oh, I see a lot of Five Guys. I don't see a single McDonald's vote. But why? Oh, we got one McDonald's, okay. So why? It depends on the customer. And Fred says there's insufficient data to make that decision. Right. I didn't ask you who made more hamburgers. If I asked you who made more hamburgers, well, you would have answered that question differently. I asked you who makes the better hamburger. And when we're looking at our social sector and are we creating any change, are we doing any good, it's about quality. It's about how well we're doing the work. What's the quality that we are doing, not just how many. So an output, if we go back to our social sector, our output is just the number of hamburgers we make. It doesn't let us know, are we making Five Guys hamburgers or McDonald's hamburgers? It's really just a count of how many things we produce. So we need to move towards a system where we know how well we're doing things and how people are better off. When you made your choice about Five Guys, you probably were making your decision based on taste. Maybe it's you like the fact that when you go there, you can see them cook your food. You have a perception that it's more fresh. You know where the potatoes came from. You know, you're making your decisions, you're making your judgments on something completely different than just the number of hamburgers one company serves. And so as our social sector, we need to really be asking ourselves, do we know the quality of what we're doing? Do we know how people are better off for what we're doing? So how do we move to an impact-centric organization? How do we make sure we have those metrics of quality and impact in our organization and they're permeating our decisions, they're permeating our policy decisions? Well, first we need to reflect on the needs of all of our stakeholders. So again, it's just not enough to say what are my whys and what is my customer's whys. We have to, there's more stakeholders as part of this equation. So we need to ask ourselves, what is my organization's whys? Why do I do what I do? So that's your mission. That's why you exist into this world. And maybe you're here because you want to solve health inequities, or you want to make sure that everyone has an equitable, high quality education, or you want to increase income or increase housing stability. Whatever your whys are, your organization exists to solve that problem. We also need to think of our funders' whys. So I mentioned back in 2008 when I was a government funder, we had some very specific whys. Yes, we did care about the constituents that we served and we wanted them to have a high quality of life, but we were also stewards of taxpayer dollars. So we had to make sure that what we invested in not only was going to be a benefit to our constituents, but that it was also going to be a good investment in our resources. We couldn't just spend money to spend money. We had to make sure that what we were spending money on was going to maybe reduce taxes, or maybe by investing in this program, it was going to move people out of a higher, paying program. So it's moving them maybe out of Medicaid into a private insurance, or it was moving someone, it was keeping people out of foster care or out of the juvenile justice system, or in a community-based setting, or out of our homeless systems, to living a thriving life, right? So your funders, they may have similar desires that you have, But you just have to make sure that you have to recognize that there might be other motivations driving their decisions beyond just your personal passion and your personal mission. And then the other person we have to think about is your participants' whys. Why do they want to participate and engage in your program in the first place? If you want to create these high quality STEM education programs to help children in underserved populations move into the tech field, that's wonderful. But if you've designed your program in a way that your participants don't feel like it's for them, they don't see themselves in it, it's not going to work. There was a health center in our community that there was tons of tax dollars spent on this, lots of public-private partnerships. A lot of money went into building this beautiful healthcare system in a low-income neighborhood. It was beautiful, access to quality of care, high quality of care. It's everything that we would expect would help solve some of the social determinants of health that this community was facing. And once they opened their doors, no one was coming. And so as we started to talk to more of the community members to find out, why are you not accessing this primary of care? The participants said, we don't think it's for us. The delivery, the cultural responsiveness of the care, the provider relationships, the quality of that care, although it was high quality of care by other people's standards, the voice of the community had not been considered, and therefore they didn't have the engagement, so they couldn't get the health outcomes they wanted. So we need to make sure that we know our whys, our participants' whys, and our funders' whys. And then once we understand those are the things we measure. Those are the things we manage to. So in order to be successful, to create an impact-centric organization, to really move the needle and drive social change, we need 3 types of metrics. Of course, we need to know what was done. We need to know who we served, what their demographics were, what we did with them. So we need to know that information. But we need to be able to pair it with how well did we do it? Were we culturally responsive? Did our participants feel like we valued them? Did they get their needs met? And then we need to know better off data. Are we improving the health outcomes? Are we increasing economic stability, housing stability, community belongingness? All of the social determinants of health that are so important for a healthy and vibrant community. And when we have those types of data together, when we know what was done, how well it was done, and how people are better off, and we have all of that data in one place, the power to make decisions and efficient and effective decisions is off the charts. We can start to understand if we have health inequities because we can analyze our outcomes by race or gender. So we can use a gender lens. We can use a race lens through the way we look at our programming, because we'll know, is everyone getting the same outcomes, or are programs working for some individuals and not others? We also will be able to look at the kind of interconnection of our programs. So in order to get increased economics, do we need to make sure that people have not just education training, but do they also need to have job coaching and childcare? And when people have those 3 combinations of services, those are the ones that are most successful. Because we can take that data, we can take that information back to our funders and say, this is what works, this is what we need to do. And then of course that quality, I already have given you one example of where we learned, and now we've learned this across 4 different sectors. Individuals living with HIV and AIDS, home visiting, access to primary care, and now we're looking at adult protective services in terms of the quality in which we do something and the outcomes. And we found that provider relations and cultural competency are directly related to outcomes. So it's not that your program is bad or what you did was bad. It's just that maybe you're not getting the outcomes you want because you're missing that quality piece, and you need to invest in the quality to get to the outcomes. And then lastly, are we making a difference? Are we really achieving the outcomes that we want? So we need all 3 of these data in a way that we can analyze them together to really become an impact-centric organization. So let me give you some concrete examples of what being an impact-centric organization looks like. So this is Arts Possible, formerly known as VSA Ohio. And they have a program within the schools where they integrate arts learning in the actual curriculum, and it's for students with disabilities and typical peers. So it integrates the learning for students with disabilities, and it integrates art. And what's really cool about this program is they have great testimonials. They've got great case studies about the impact that this program has had on kids. But in addition to their great testimonials, they have their output and outcome data. So for example, this is the case for support they're able to share. They know they've served 2,000 kids last school year, and 52% of them were a student living with a disability. So a funder now knows, okay, I know the extent that your program is serving kids across the state, and I know half of them have a student disability. So when you tell me you're integrating students with disabilities and typical peers, you are. There's proof there. Also though, beyond that, they know that 100% of the school administrators of the schools that they're in say that they agree their programs impact student learning. So we have those constituents, we have the data about the quality. The quality is, yes, we are seeing evidence that your program, we perceive your program is impacting student learning. They have feedback from the teachers. 80% of the teachers agree that the program increases student creativity and appreciation of arts. So some evidence that, okay, we're not just about student learning, we're also about creativity. We're about appreciating art. So we're hitting that art outcome that the program cares about, that Art Possible cares about. We're also hitting the learning objectives that the administrators care about. And then how are kids better off? They knew that students experienced an 18% increase in the rate of growth in their reading fluency scores compared to before being in that intervention. So they also then have how kids are better off. We're accelerating their learning through this program. And so that's an example of how not only do they understand how well they're doing something, the outputs of that program, but then how are kids better off? They've been able to take this data, share it with the Ohio Department of Education. They continue to get funded to deliver these programs to these students with and without disabilities to achieve their mission. And I love this program. I always feel a bit passionate when I'm talking about them. Here's another example in the housing education. And what this shows is that multiple outcomes demonstrate a complex story. So most programs don't have just one outcome they're trying to manage. Like even back to this COVID example, there's multiple outcomes that we need to manage to. We need to manage the health outcomes. We also need to manage the unemployment outcomes. We need to manage the adverse childhood experiences. We need to manage the education, right? It's not just one size fits all when we're talking about how communities are better off. So this is an example of a homeless provider, the housing provider for homeless people. And what we learn is that not all outcomes are equal, but it gives them a dashboard to show where they need to improve. So they can talk about increased earnings, that their residents are earning $116 more a year than they were a month than they were last month. So there's some evidence of increased earnings. Look at improved access to healthcare. 50% of their residents have improvements in healthcare. Improved family relations. About the same, 46% of residents improved in this domain. So those are some examples where they can start to ask themselves, is 50% okay? Or do we need to focus more on these areas because these are things that matter to us? They also learned that 60% had successful no-fault move-outs. So those individuals who moved out of their residency moved on to have positive, they would consider that 60% a positive outcome for those who moved out, and 40% of them had a unnegative outcome. They also then looked at their eviction rates based on program. And what they learned was that in this one program, 60% of move-outs, sorry, that's error, but 60% of move-outs were due to eviction. So now they knew, okay, this particular program, something's going on. Why do we have so many evictions in this particular program? And they could go and do some triage and program improvement to fix it. They also had a social enterprise, a kitchen that taught their residents restaurant skills. And they learned that 74% of their students did receive this Safe Serve Handling Management Certificate. And 85% of their students maintained employment 6 months after participating. So you can see how they can take this data and they can share their impact story with funders, but they also can use it for quality improvement and ask themselves, is this okay? Is 50% okay? Or do we want to set a higher target? Do we want to work towards 60% of them have improved family relations? And we definitely need to get that 60% eviction rate down. That's not helping us, that's our choice. Like, how do we improve that? What's going on there? What can we do? This is a really cool thing that Pathlight Home found. Because they had those measures, because they were able to understand, you know, what they did, how well did they do it, and are people better off, they were able to link what people received in their programs as well as the outcomes that they received. And they learned that residents who received case management services were 2 times more likely to have a successful or no fault move out than compared to residents who do not have case management. And why this was so important is this particular program, some of their funders paid for case management and others didn't. So there were some residents, not because they didn't need case management, just because of the way the funding structures were, they were missing out on valuable opportunities to increase their housing stability. And so when they had this data, this very compelling evidence that case management matters, it's not just okay to have a safe place to live, we also need to have case management wrapped around our residents. They were able to then go and take that to funders, and they raised more money so that they could provide the case management services to the individuals who did not already have it. So those are some really powerful examples of how organizations have put together their output, their quality, their outcomes, and their impact data to drive social change and to achieve their mission. So hopefully you take some ideas or thoughts about how your own organization can do this or should be doing this, and realizing that by moving to an impact-centered organization, number one, you're going to do less harm. You're going to make sure your programs are effective and efficient. It's going to allow you to make sure you're not continuing the social inequities that we're seeing. But one thing COVID has done, which is great, it's really risen up to the national zeitgeist about how you know, there's a lot of health disparities in our communities, and a lot of those are driven by social determinants of health. And I think many of you who that's part of your mission can use this opportunity to talk about how you are addressing those social inequities, but you're going to need data to show how your outcomes help all levels of the community. You're going to be able to only focus on the things that matter. Let's face it, we might be in a shortage of resources, but we're going to be able to know where to go and how to use our resources. Stand out from the crowd like Pathlight, like Arts Possible, and become the industry leader. Become the program that those individuals want to fund, that funders want to fund, because you know they're solving the problem. And of course, have the data that makes a compelling story for donors to donate to your organization, especially in a time now where funding is going to become tight. It's going to be a little more competitive. We don't have some other ways to fundraise like galas and other things. Impact-centric organizations are going to be more successful in the next few years. So what do we need to do? You might be thinking, this is great, Sheri, I get it. I want to be more impact-centric. What do I need to do? Well, first you need to clearly define your output, outcomes, and impact metrics, and making sure they're aligned with your mission. And that whys exercise, the what are your whys, what are your participants' whys, what are your funders' whys, that's a really easy way to get started. Second, you're going to need to have effective and efficient systems that are incorporated into the natural workflows of your organization. So what we've learned is number two was what stops a lot of organizations, is they might know what they want to measure, but they don't have an effective and efficient way to collect the data and to use the data, or have the timely data reporting that they can then communicate with staff and stakeholders to drive social change. And then you're going to need a process for taking that data in, using it to make decisions, and celebrating the success and the effectiveness of your programs, sharing it with your funders so that they can support you and advance your mission. So we need all four of these to create an impact-centric organization. And we want to help you do that. We want to help give you those efficient and effective tools so you can be straight to having that impact data at your fingertips whenever you want to drive social change. So I'm excited to talk about SureImpact, which is a cloud-based, secure technology that helps social sector organizations move from an output-based organization to an impact-centric organization. And so for the past 10 years, I've been working with organizations like you, helping them define what they should measure, collecting and analyzing the data, using the data to drive results like Pathlight and Arts Possible that I talked about. But what we've heard over and over again from our clients is, what technology should we use? And we thought, let's figure this out. Let's create the technology that automates those processes, that helps you become an impact-centric organization. And so over the last several years, we created that tool. We created the system that we believe that helps drive impact-centric organizations, because it gives you those insights that you need at your fingertips. But it starts from the individual level worker. So it acts like a case management system. So your individual level workers that are working with one individual can track everything they do. So it tracks all of your outputs. And then it allows you to have your outcomes and your impacts on a dashboard. So a leader can log in at any given time, log in and say, hey, how are we doing? How are we moving the needle? Managers can have different conversations with line staff. So instead of just talking about, how many people did you serve? What's your compliant, are you compliant with our productivity goals? We can start to talk about, how is your caseload moving the needle on the outcomes that matter most to us? What can we do to improve that? It changes the conversation that organizations are having from just outputs to actually the things that matter most and that are actionable and measurable. And then you're able to take those insights to your funders and raise more money. So that is, I wanted to share a little bit about SureImpact with you today. I would love to dive in more in the future around your impact. And Laurel, I realize we don't have our webinar title on the slide there, but so I have two opportunities for you today. The first is, I would love to meet with you personally and do a sustainability analysis with you. And what we would do is we would be on the call for about 30 minutes and just talk about kind of what challenges you're having with the outputs and impact data that you're collecting. What challenges are you facing? Maybe some tips and tricks that I can help you get unstuck, or say, hey, maybe have you considered measuring this? We can talk about if SureImpact's right for your organization. And then we'll also be offering another webinar on June 18th, which is around how to, what is the title, Laurel?
Yeah, sorry about that. So the title of our webinar on June 18th is How to Mobilize Your Community and Create Lasting Change.
Yes, absolutely. So we're going to talk about, how do we take this data, these insights, and drive social change in our community? How do we communicate it in a way that's effective to really drive change? So there's some opportunities that we want to bring to you to continue to move you towards an impact-centric organization. But I do believe we have a few minutes for Q&A. So I'd love to answer any specific questions that any of you may have.
Yeah, thank you, Sheri. That was excellent. So we've had some great questions come through. If anyone else wants to submit them, please continue submitting them through the chat. So the first question we had was from Connie Graft, and she said, when you work with organizations on the why, do you use the 3 to 5 why exercise to help them determine more specific whys?
Yes, I absolutely do. I use an exercise called the 5 whys exercise. So why do you do what you do? And then you ask the question again, so we kind of continue that process. And Laurel mentioned it in the intro, but I did write a book called Impact and Excellence, and that whole 5 whys process is documented in there. But the reason those 5 whys is so important, or asking the whys of your organization, your funders, and your participants, is those become outcomes. So I use whys because it's an answer that's really easy. It's a question that's easier to ask than if I said, what are your outcomes? People might freak out and think that they need to have something smart or measurable. And so it's not so much about putting measures to it yet, it's just turning those whys into your short and medium outcomes. So great question.
All right, thank you. So next question is from Karen Jululi, and she says, some funders don't understand that providing high impactful services are costly, higher per person costs, and take time. They want a high number of participants who are intensively impacted in the one-year grant cycle. So
Mhm.
Sheri, how would you recommend starting this conversation with funders?
That's a great question. Thank you. So this is if you guys are taking notes, I would ask you to write this down, and maybe we need to do a whole webinar on this in the future. But it's a metric called cost per success. And so if you have outcomes in your organization, so let's say we go back to Pathlight and they knew that only 60%, or you could say only, or 60%, either way, but 60% of their clients had successful move outs. So you could say their success rate was 60%. Well, that is a residential housing program, a permanent supportive housing program. You can imagine that that's got a significant dollar amount attached to it. So what they would do is they would take the number, how much it costs to run that program, divide it by just the number of successful participants, not all of their participants. So what that number now tells you is that's how much it currently costs that organization to get to one outcome. So that's your cost per success. So as you're talking to funders, you have a realistic number to share with them and say, look, if you want us to get one person to a successful move out, it's going to cost, let's say it's $20,000. So now they understand how much it costs to get to that outcome. But what's also cool about that metric is that as you increase your success rate, your cost per success goes down, but you don't necessarily have to ask for less money. So let that sink in. Your program costs can stay the same, but if you increase, the number of people you successfully move out, your cost per success goes down. But you can still operate your program with the same amount of money. So I think that's a great metric to start to show realistically. Instead of just telling them how much it costs to serve a person, you can change the conversation about buying outcomes, right? You want affordable housing, this is how much it costs to keep that's our success rate. So that's a great metric to change that conversation. And I'd love to have a follow-up conversation with you, schedule a sustainability analysis, and we can really dive deep into how you could do that. So great question.
Perfect, thank you. Next question is from Justin Showers, and he says, is it a fair comparison to say that outputs versus outcomes is somewhat similar to quantitative data versus qualitative data? If that's not an appropriate analogy, does that mean an organization can use, or perhaps needs to use, both quantitative and qualitative data to measure impact?
Absolutely. You definitely need both. I don't think that it's necessarily a fair comparison to say that outputs is definitely quantitative. But when we go to qualitative with the outcomes data, it's going to be a mix. So some quality data would definitely be more qualitative, right? If you have staff satisfaction, or you have or participant satisfaction or client experience data, that's going to be more qualitative. But you're going to have other quantitative outcome measures, such as increased wages, or maybe if you're looking at medical data, decreased rates of diabetes, or increased number of jobs, or percentage of people who have maintained a job over the year. So those are quantitative metrics as well. So I wouldn't say that outcomes is only qualitative, but some of it may be measured qualitatively and some of it may be quantitative.
Right, perfect. Next question is from Retha Parthiban, and she says, during COVID time, lots of funding is being given out. Are there any frameworks for developing indicators for unplanned work?
Interesting. That's a great question, Rita. So I'm a big proponent in organizations establishing their whys. So we talked about your whys, which becomes your measures, which becomes your, the outcomes that you're driving towards. And so when new funding opportunities come, like through COVID funding that's been coming into our communities, it doesn't change what you do and what you're trying to solve for, right? If it is about keeping people healthy, if it is about keeping people stably in their own homes or having the right education opportunities, whatever outcomes you're trying to achieve, those will change. So what's exciting about when you create an impact-centric organization, you already have your outcomes in place. You have your measurement in place. What might change is the way you do your work. So you already know how you're going to measure success. What might change is now, well, you might have been doing in-person work. Now you have to do telehealth. So the way you deliver it's going to change, but not what you're trying to achieve. You've got your measurement framework in place, and that actually helps mission creep. It helps make sure that your core mission stays central. That doesn't change. It's just what you do to solve that problem might have to vary. And SureImpact is a great tool because it allows you to quickly pivot on what you do while keeping your impact metrics central.
All right, perfect. Another question from Connie. How do you help clients determine who their target audience is, and what do you do when they resist doing that?
Well, that's interesting. I don't know that I've ever had anyone resist knowing who their target market is. Well, I asked some pretty simple questions, and that is, who participates in your programs? So that would be that's your participants, right? That's who you're trying to change. Whose lives are you trying to change? And then what are their whys? And then I ask who funds you and why do they fund you? And so really, I think that becomes, your stakeholders are, whose lives are you trying to change and who funds you? And then of course, those within your organization themselves. It may get a little more complicated if you have family, but again, Connie, I'd love to chat more about those questions because you're asking some great questions.
All right, perfect. We have a question from Linda Henriksen, and she said, I'm in Canada. Is SureImpact designed to support a Canadian client?
Absolutely. It's it's cloud-based. It can work with any organization. So let's talk.
All right, let's see. Okay, we have another question from Karen. So this seems to require gathering a lot of data from participants before, during, and after program participation. Sometimes this creates a barrier to creating a trusting relationship. Sheri, how would you address that?
Yeah, I think that's a great question. And it doesn't have to be like a litany. I know some people have experienced evaluations in the past, or like a university has come in and done a full-blown study where there's long lists of assessments and tools. That's not really what we're advocating for. We're just advocating for some key questions or key metrics that you're asking throughout the process of engaging with the client. Obviously, trust has to be established. You don't want someone to sit down in front of you and you just hand them a piece of paper and say, tell me all of this data about you. But there's a way during that intake process where you can engage with them. Maybe at the beginning, you just get some really quick key information to get them into your system. And then you have a couple more questions you ask them a little bit later once their trust has been built. And you set expectations. You let them know up front that, we're going to be, because it is a goal of yours to increase your housing stability or to increase your housing goals. A part of our process and part of our program is that, you're going to take this, typically if you're thinking about like skills, that's part of your programming. So you embed the data as part of your programming. It's not only useful to you, but it's useful to them as well. It gives them a sense to understand how your program has benefited them. So again, remember that people are in partnership with you. They want to participate in your program for the same reasons that you want to, and you use that data as part of their feedback loop on their progress as well.
All right, that was a great answer. So thank you so much to everyone for submitting questions and for your participation today. We are out of time, so we will be sending out the recording and slides in the next few days. Also, make sure to join us for our next webinar on June 18th, where we will discuss how to mobilize your community and create lasting change. And thank you again to everyone, and have a wonderful day.
Absolutely. Thank you. This was so much fun. And I hope I get to talk to many of you with our sustainability analysis calls. See you later.